Well, with years of rising overdose deaths, law enforcement and recovery organizations are raising the alarm about fentanyl. Officials know the synthetic opioid is driving the state's overdose crisis. But as Mitch Legan reports, some recovery organizations are finding it difficult to expand harm reduction efforts.
I met Karen Warpenberg at one of her daily trips to check an overdose reversal kit.
And some safe use kits, some brochures, and then I have the Narcan, which is what I'm going to replace.
Warpenberg is the executive director of the Evansville Recovery Alliance. The group started a couple years back to respond to increasing drug overdoses in the area.
Yeah, it looks like they're already kind of full.
Most of those overdoses have been caused by the powerful synthetic opioid fentanyl. Just 2 milligrams of the drug can be lethal, but its effects can be reversed with the overdose antidote Narcan. That's why Warpenberg's out here. She wants Narcan to be easily available throughout the city.
It's just a nasal spray. You just depress the plunger and put it in the nostril.
In recent years, fentanyl has come to drive Indiana's overdose crisis, but not because drug users are seeking it out. Dealers have begun mixing it into other drugs unknown to buyers. It's a story Warpenberg knows all too well.
I had a friend overdose last year from fentanyl. He had been in recovery and just used, as far as I know, once and died from it.
Like the rest of the state, Evansville and Vanderburgh County experienced record overdose deaths the past 2 years. Almost 60% were the result of fentanyl. Warpenberg says despite the clear data showing fentanyl's pervasiveness, mobilizing support for harm reduction in the area has been difficult.
It's just not a popular idea. It's, for conservative people that just think drug use is bad and people should stop using drugs. But we need to help those people that are using drugs to get them to a place where maybe they want to stop using.
For example, she'd like to start including fentanyl test strips in the overdose boxes, but under Indiana law, they could be considered drug paraphernalia. The county prosecutor has said he won't do anything about them, but without anything in writing, Warpenberg isn't taking any chances.
Making sure that the fentanyl test strips are legal, and then also providing a syringe exchange is really important to us, and we think it would be really helpful.
She says needle exchanges around the state have proven effective in connecting drug users with resources and eventually getting them into treatment. But officials haven't been keen on the idea of providing drug users with needles.
It's just difficult in this community. We are working with the health department to try to come up with, an agreement on it.
Evansville's location on the state border makes it a prime spot for drug trafficking. Just last week, the U.S. Drug Enforcement Administration joined state and city officials to announce they'd broken up a local fentanyl ring. Authorities seized over 1,000 fentanyl-laced pills and the presses to make them.
We continuously seize thousands of fentanyl pills on a yearly basis in multi-kilogram quantities of fentanyl here in Evansville.
Gannon says that investigation highlights a growing trend. More fentanyl is being produced domestically and to look like legitimate pharmaceuticals, not just street drugs like cocaine or heroin. He says ground-level advocates like Warpenberg are key to stopping potential overdoses.
It's 50 times more potent than heroin and 100 times more potent than morphine. So you're going to get people addicted. We need to understand, in law enforcement, in the community, we got to come together, because we can't just arrest our way out of this.
Warpenberg says her group has been able to expand harm reduction efforts in the area. They just installed the city's 6th overdose reversal box. But she says continuing stigma will make progress slow.
They don't think they're going to run into it in their own lives. But I think the more that people know and the more work we do, that, there'll be more of a positive outcome.
Although it's been gradual, she believes people are seeing the value in her group's work. Just last week, she heard from 2 people who used her Narcan to save a life. For Indiana News Desk, I'm Mitch Legan.